Hi, I'm Felicity, registered nurse, cosmetic injector, and founder of the Fit Injector Clinic. Welcome to my channel and new podcast, the Fit Injector. From today, you can watch and listen to this new exciting video podcast on YouTube, Spotify, and Apple, featuring guest speakers covering all topics within the cosmetic industry, business, and of course, mum life. Now, kicking off the first episode today is risks, misconceptions, and myths of the cosmetic industry, covering cosmetic injectables and cosmetic skin treatments. And what better person to have on this first episode with me than Elin, who joined me at this brand new clinic earlier this year. Intro to Elin. She's a registered nurse training with me to be a cosmetic nurse, working closely alongside me every day, doing both in-house and external training, and also studying her diploma in cosmetic nursing. She is fully trained in all our cosmetic skin treatments and also anti-wrinkle injections, and the patients are just loving you.
Thanks.
So I've been exposed to this for ages, but it really brings it to light when you have someone working alongside you. You're teaching them, you're talking about what you're doing, you're discussing each patient and each consultation with them. And to have Elin so surprised by how many patients have been having treatments for many years at other clinics, and then they land in our treatment chair and they're shocked when we start rattling off the risks of the medical treatment that they are about to consent to. Also, since opening this new clinic about 2 months ago and having that influx of new patients, this is feeling more prevalent than ever before.
For sure.
I also think that this episode is happening at a great time because in the last couple of weeks, some new updates have happened to the regulations of the cosmetic industry by APRA, which is the regulatory body for medical professionals in Australia. And interestingly, it gained all this popularity on social media by non-medical professionals having this absolute freak out that they would need to see a GP or a psychologist before their next anti-wrinkle treatment, which is not true, by the way. We can debunk that myth right here and now. And these updates mostly focus on cosmetic surgeries and mental health, such as body dysmorphia. But in terms of cosmetic injectables, we already consult you and screen for things like body dysmorphia and other mental health issues. We utilise telehealth with our team of medical doctors prior to doing any of the treatments, and we also follow all the regulations for registered nurses within this space. So a huge misconception of the cosmetic industry in the last few years, as the industry is growing rapidly, is that these are beauty treatments and people aren't taking these risks seriously, when in actual fact these are medical treatments performed by trained medical professionals, and these risks need to be discussed with every patient, every treatment, every time, as we do. So I think this is also why the new updates really blew up on social media, because people seemed shocked but also unaware of the processes that we already follow. I think it was like they were suddenly like, oh my gosh, there's all these changes, but I don't think they'd ever stopped to realise that there were regulations already in place, that these things are actually really only minor changes that are going to have to happen to the way that we do our consultations. And our patients probably won't even notice these changes.
Exactly.
It'll be so implemented so subtly.
Yeah.
So I want to hand over to you for a little while, Elin, to give us some examples that you have noticed in the past few months working here with me, starting this new clinic, of when we're in with patients and I'm saying things and you're saying things and they're saying things. And then when we come out and we have our discussion after and you're like, oh my gosh, I can't believe this, and this. So I'd love to hear from you some of these things that you've noticed.
Yeah, I think on my end, I've definitely been very shocked with some of the things that have happened. So first and foremost, people not being aware of filler risks.
100%.
Which is very scary because like vascular occlusions, they obviously can be incredibly, I guess,
dangerous.
Yeah, for sure. And Siri decided to chime in just then. And I think the biggest one that I've definitely had is patients not being aware that filler can be dissolved.
Yes.
And that Hyalase doesn't exist. The medication that dissolves filler is called Hyalase, which is really
Yes.
scary. I mean, obviously, if patients have permanent fillers, we can't dissolve that. But I guess it's always good to be aware of what's going into your body and that it can actually be dissolved
Yes.
if needed.
And patients need to know that, firstly, because of any of the complications, like you said, a vascular occlusion,
Yeah.
legally we have to carry that medication to dissolve that if we have to.
Yeah.
But then in our consultations, we also say to clients, you know, in that rare event that you didn't like your filler, or say you got, you know, not an adverse event, but maybe you had some lumps and bumps and things down the track, is that we can dissolve that. And like you saw the other day in particular, there was one particular patient had been walking around with this filler that she absolutely hated, lumps, bumps, you know, obviously from another clinic, not from us. And she had no idea when you started to explain to her that we could actually dissolve that for her.
Yeah, exactly. And that's kind of scary, I guess.
It's terrifying.
Yeah, like walking around feeling as though you
Can't do anything about it, and you're just
Yeah.
like waiting for this product to break down, which
Yeah.
sometimes, and we'll talk about later in some of the questions that we've got, sometimes it just won't break down on its own, and you do need to dissolve it and start again.
Yeah, for sure. And yeah, not following post-care advice.
Yes.
We've had a few patients who will sort of like say in the consult that, oh, I just lie down straight after my anti-wrinkle treatments.
I go to the gym.
Go to the gym, have a HIIT workout.
Go have another facial somewhere else.
Face massage.
Yeah. Yeah. And then we're waiting for the 2-week review where they've got a dropped brow because they've, you know, gone and done their, the best one I heard was I'd injected her with the anti-wrinkle and she said, oh, I'm going straight to do my upside down yoga, like hanging, you know, there's hanging.
Yeah.
I was like, can we skip tonight, please?
Upside down yoga.
Did she take my advice or not? Who knows?
Hopefully.
I can confirm her brows were not dropped.
And another one is that nothing has gone wrong before.
Oh, I love this one.
So again, it's sort of like that expectation.
Yes.
I guess managing the expectations.
Yes.
And that like with every appointment, regardless of whether you've had anti-wrinkle in the past or if you've had filler in the past as well, things can still go wrong. Risks are risks. And yeah.
Totally. And that's why we talk about it every time. And
exactly.
I think that comment of, oh, well, nothing's happened before, or oh, you always do such a great job.
Yeah.
And well, yes, and we always strive to doing treatments in the safest way possible.
Yeah.
But no matter, you know, any injector, any injection, any time, there is always that risk. And
Always
things
risks.
aren't going to be 100% the same every single time.
Yeah. And I think in the consult specifically, sometimes patients are like, oh, I know about that. I know about this. But legally, we do have to discuss those risks with you. And yeah.
Totally. And I just think, imagine if we didn't talk about those things and something does go wrong. And then in that moment where you're panicking, your patient's panicking, and then you're going, so there's this thing that I didn't tell you about. And now we're going to have to deal with that.
Yes.
That conversation is going to be so much harder than having that conversation prior. And then you're like, remember how we talked about this? This is what's happening. And remember, this is how we're going to manage it. And the whole situation is going to be a lot calmer. For sure. And I also think really taking that medical standpoint with these treatments is that patients know what can go wrong, but they also have the confidence in us that we know what to do. Yes. So when we go, okay, these are the risks and this is what we would do about it if that was to happen. And also with that follow-up and that post-care, and this is some of the changes that come in with these new regulations, is around patients being really clear about what treatment they've had and how to get in contact with a clinic after hours. And this is something, again, that shocks me. I'm going to add another point to this section, is the amount of people who they've been treated by other clinics and they'll say, oh, yes, something happened, but I couldn't get in contact with them until the next morning. Or say it was a Friday night and the whole clinic takes the weekend off and this patient's got a complication that doesn't get dealt with until Monday morning. Whereas our patients always know that they can call us. Yes. And I have that phone with me all the time. I take that phone home, the clinic phone, and I check it, you know, regularly when I'm at home as well. And they always know that they can contact if there was something. And I would come in if it was at night. I would come in if it was 2:00 in the morning. I would come in and see a patient if I had to.
Yeah. And I guess as well, like for our patients, if you have a bruise that looks suspicious and you're worried about, it doesn't annoy us, you getting in contact.
Yes.
Like it
Yes.
absolutely so fine. We would rather that you contact us than not,
Yeah.
I guess. And then
Exactly.
you're just sat at home worrying.
And thinking that they don't have support, or thinking that maybe we did something wrong, or, you know, a lot of the time our patients just need reassurance that what's happening to them, like you said, bruising or swelling, that's a normal process. But also it's great for us to make sure that we're ruling out that they're not having an adverse event as well.
And then lastly, our overseas patients.
Love them.
So in Australia, regulations are very different to overseas. So specifically patients from the UK who come to Australia, they get quite shocked that we prescribe our medications.
Yeah.
And in the UK, anyone can be an injector. You don't have to be a registered nurse. You don't have to be a doctor. So it's very
the Wild
different.
West.
Yes, it definitely is. And patients just get super shocked when they come here and they have to have a telehealth consult with a doctor to get that prescription.
Yeah.
So I guess like drilling that in patients as well when they come visit us, that like you do have to be a registered nurse or a doctor.
Yes, you have to do this. And if someone wasn't doing this, red flags.
Red flag.
Run for the hills.
Run for your life.
So a couple of days ago, I put up on our Instagram that we were kicking off this series and you would be joining me. And I put out one of those little question boxes for our followers to ask some questions about risks, myths, and misconceptions of the industry. And we got some great questions, and we've broken down some of the best ones, and we'll do a bit of a Q&A now.
Let's do it. Don't mind me with my phone. I've got the questions here. So as an RN, do you need to hold any extra certificates to do injectables legally?
So you will, to treat patients, you will need to have done some kind of course in starting areas of anti-wrinkles, so your frown, forehead, and crow's feet, and what they consider your starting areas of filler being your lips and cheeks. And obviously there are courses out there that go for 2 days. If you feel comfortable doing a 2-day course and treating patients, go for it. I see things quite differently. I think people need a lot of training before you start doing things like that. So I would recommend to book as many training courses as you can, and in particular, book a course in complications management, because like we were talking about before, you need to know how to manage things if they do happen. If you were injecting anyone, you need to know how to manage those complications. The next thing is, because this is a non-acute setting, a cosmetic clinic, you do actually need to have your first aid and basic life support. So you need to go and do those with an external training provider. And you also need to have public indemnity insurance and public liability insurance as well. But the main criteria in Australia is the qualifications that you officially need to hold is to be a registered nurse or a doctor.
And how long after dissolving can you get new filler?
Oh, this is a good one. Because when we talked about, if someone has, lumps and bumps and filler they don't like, they're all on board for dissolving, but they want them refilled, let's say lips, right? And they want their lips refilled the same day. So that is a no-no. Because the dissolving agent works instantly, and we can see that happening when we dissolve, but it will continue to work for about 12 to 24 hours after that. Plus you're going to get some swelling, a little bit of trauma because we have injected those areas. So my policy, and I'd say most clinics' policy, is to wait 2 weeks before refilling the areas. That helps to make sure that all the dissolving agent has done its job, because what we don't want to do is dissolve and then say you were to do it the same day or the next day, is you're injecting new filler and then it's actually dissolving. So that would be even more heartbreaking for the patient. So I say wait 2 weeks. So make sure all your dissolving has taken effect, but also to make sure that the swelling, any bruising and things like that from the dissolving has calmed down as well. We want the lips really nice and healed. And I also really love to see people at that baseline as well. Because that's when we can really assess, what do your lips look like? I'm focusing on lips because most people end up dissolving their lips at some, for lumps and bumps. Very rare that we have to dissolve other areas. But it was really great to see people's, or let's say faces at baseline, and then determining, do they have any natural symmetry, what product is most suitable to re-inject with and things like that. So that was a long-winded answer, but 2 weeks.
We want a blank canvas.
Yeah, exactly. And sometimes, sometimes people go, I actually really love my lips as they are. And then I'm like, you know what, my job here's done.
We've had that quite a bit recently, actually.
Yeah.
Yeah.
Or they'll just want maybe like the tiniest bit, back. And I think I'll digress a little bit here, but one of the most probably like powerful dissolving moments for me with a patient, and this was probably about 2 years ago, was someone they'd had, so much filler done what I call clinic hopping.
Yep.
Until they land with an injector that says no, which is me, right? And then I'm like, this is Hylays. It's our new friend. And it was incredible because, and she was kind of like, yeah, like I don't love my lips, but okay, I'll do this process with you. And we dissolved them, and she came back 2 weeks later, and she did a lot of presentations, and videos and things like that. And she came in and she was like, I had no idea that I couldn't articulate my words properly because she had all this filler sitting in what we call the wet border of her mouth. She couldn't speak properly. And she comes back and she's like, I can speak properly. And then we did a really small amount of filler, very natural look, injected it where it should be sitting. And she can't believe that her lips feel like normal lips. Yeah. Because before they felt like firm and, as I said, couldn't talk properly. Wow. And that was probably the most powerful dissolving.
That's awesome.
Situation I ever had.
Wow. Yeah. Amazing. We'll move on to the next question.
Okay.
Can you get an infection with dermal filler?
Yes, you absolutely can. So dermal filler is a hyaluronic acid. Think of it almost like a hair gel consistency. It is a lovely sugary molecule. So bacteria love it, unfortunately. So that's why when you have treatment, we are very pedantic about you not having makeup on because that is an infection risk. And if you do, we will triple cleanse your face and then also use the antibacterial wash prior to your treatments. Yep. And then before every injection, we're also using the alcohol swabs. Afterwards, I'm putting on a barrier cream, which is also antibacterial. And that's why when we talk about post-care and following it, particularly after dermal filler, it is so important that you don't wear makeup for at least 24 hours. Yeah. Because you think you've got these tiny little holes, and if you see them under a microscope, there's actually this fascinating photo that goes around on social media. If I see it again, hopefully, because my phone's listening to me. If I see it again in the next few days, I'll pop it up on my stories. But it's incredible. Under a microscope, you just think it's tiny, we use tiny needles, so you think it's this tiny little hole. Under a microscope, it looks massive. And you think you get makeup, you get dirt and things like that. Yes, you can get an infection. Now, it's really rare if you follow the post-care, and obviously as a clinic that we're treating you in a very clean, suitable way, and we're really minimizing that risk. But so important you follow that post-care because if you do get an infection, it's really traumatic for the patient because we have to put them on, a long course of antibiotics, and sometimes we will also have to dissolve the filler because, the infection will happen in a way that, antibiotics just aren't cutting it. And then we have to dissolve it all and, potentially start again, and then the patient might not actually want to go through with that. Yep. So infections are super rare. Hand on my heart, none of my patients have actually ever had an infection, which is amazing. But I've obviously seen a lot of cases, particularly online, that people have shared, and it's nasty. So really important, if you only follow one thing after filler, don't put makeup on.
Don't put makeup on.
Please.
I mean, with every injection, there's always a risk of infection, isn't there?
Exactly.
Yeah.
Yeah. And I think that's why we also cringe, if people come in with 3 layers of makeup on, and because we know, okay, so the first 15 minutes we're going to spend scrubbing your makeup off. That's also why we do kindly ask if you come in fresh-faced.
Yes.
It makes our assessment so much better, particularly if we're trying to look at your skin too. But it also means we can just, get straight into your treatment, cleaning you ready for the treatment, rather than spending all this time taking your makeup off as well.
Exactly.
And sometimes people come with makeup that's so thick, I'll be triple cleanse, and I'm I have to do a 4th cleanser. I just feel you cannot get it off, and that
takes out of the appointment time as well.
It does. Yeah.
Okay. Can I have cosmetic injectables when pregnant? This is a really asked question, by the way.
I feel we get asked this question literally every day.
Yes.
Be it in the clinic, on social media, everywhere.
Yeah.
And I feel like people know the answer to this, but they always just like to check. Like
they want us to say the answer. Yeah.
But is there a rule? So the deal with cosmetic injectables and being pregnant and breastfeeding is, look, the research shows us that your anti-wrinkles and your dermal fillers probably wouldn't cross the placenta to the baby.
Yeah.
But there's no research on it. That's why we have a blanket rule that when you're pregnant and you're breastfeeding, we don't do your anti-wrinkle and your dermal fillers.
Yeah.
Also because we do have to use some numbing agents, particularly with dermal filler, and we don't want to be administering those when you are pregnant.
Yeah.
And also because it is a voluntary treatment, it's not a necessary treatment to do.
Exactly.
But because there's that lack of research, no one's ever going to do a research study on injectables and pregnant or breastfeeding women.
No.
And if we were to say inject you and something happened to the baby, the first thing you're going to think is, oh well, I had those anti-wrinkle injections when I was 3 months pregnant or something like that. So yes, it's awful that you have to go that long. Most people can survive without their fillers, but especially if you've been having anti-wrinkle for years and then you fall pregnant, you're like, what do you mean I have 9 months? And then I'm the bearer of bad news because they think, the day I pop out that baby, I'll be back. And I'm like, if you're going to breastfeed, so for some people it can be like 2 or 3 years before we see them again. Yeah. But during that time, the most important thing is your little baby and the health of your little baby. And we will be here, needles ready when
needles
ready. That as soon as you've had that baby, and if you decide to breastfeed, as soon as you finish breastfeeding, we're ready to go.
Yeah.
And then I usually follow that conversation with, there's actually lots of things we can do to really help kind of maintain. While you're pregnant and breastfeeding, we can do our LEDs, we can do light chemical peels, we can do our hydrofacial treatment as well. You can use pretty much all active skincare, so you can really maintain your skin.
Exactly.
And then when you're breastfeeding, you can also do our face shape, the radio frequency skin tightening. That I made my husband do that on me like a week after I gave birth. It was actually so good.
Did you?
Yeah. It was so good for the puffiness. I'm like, you filmed enough of this, you can do my treatment. And he did. It was awesome. It was so good for the puffiness to get rid of that. So you can have that when you're breastfeeding, and we are baby friendly. You can bring your babies in.
Yes.
Mine was sleeping in the bassinet while I had my treatment. It was great.
We've also got Lucy at the front, and she loves a bub.
She loves bubs. So I know some people are like, don't bring your babies. I understand that not everyone has care for their babies, so you can bring them in.
You can definitely bring them. We're a baby friendly clinic.
I'm a mum. Totally. You'll often see my kid in here. And when you're breastfeeding, you can also have our new Transcend Photo Facial, which is great for pigment, redness, broken capillaries. So really good, particularly if your skin does change. You do get that redness and capillaries during pregnancy and breastfeeding. And pigmentation is a big one, getting that during pregnancy as well. And then if you finish breastfeeding, if that's what you choose to do, you can go back to having everything again.
Exactly.
Yeah.
It's only a small part of your journey.
I know. And when you look at like a lifetime of having treatment, it's, it's only 1 to 2 years that you're not having treatment. So
yeah, exactly.
You'll survive.
You'll survive. So does filler show up on CTs, MRIs, and X-rays?
So it can actually show up on scans. And this is quite an interesting one that I actually bring up with patients who say, like we were talking about before, they've got, let's say, the lip filler that's migrated.
Yes.
And they're like, I'm just waiting for it to go away. And I'm like, so when did you have that filler? I had it, 3 or 4 years ago. And then you break it to them, well, it's actually probably not going to go away. And over the last few years, as this industry has grown really, really quickly, there's doctors out there that are doing research into how long these fillers actually last.
Yeah.
Because our pharmaceutical companies, they say their products will last, depending on the product and the consistency, it might last 3 to 6 months, it might last 6 to 12 or a little bit longer. But what we're now seeing is, especially when fillers migrating, outside the areas where we've put it, filler can be there and it can be seen on scans like 5, 7, potentially even longer, that many years later.
Yeah.
And so when someone's going, I'll just wait for it to go away, it's probably not going to go away.
Yes.
So it's a really interesting educational piece for people that you probably need to dissolve and start again. But yes, it can come off on scans.
Yeah. There we go. How to start out as an injector?
Oh, this is a good question.
This is a really good question.
This is another one I get.
FYI, I actually did watch Felicity's videos before.
Did you?
Yeah, I did.
Aww.
Before I started out.
Oh, that's so good.
She's got great content
You're
on
probably
YouTube.
sick of hearing my voice before you
No,
started, and
no.
now you get to listen to me all day, every day. That's awesome. Well, you've already given a plug to it. So I get asked this question in comments, DMs on YouTube, everywhere,
Yes.
literally every day. So my first recommendation, plug to my YouTube channel, is go and have a look. I've got lots of videos on there about how to get started as a cosmetic
Yes.
injector, whether you want to work for a clinic, whether you want to start your own business. And I also do mentoring for cosmetic injectors that want to start their own businesses as well. So plug to both of those things. And then I will do like a sneaky announcement, non-announcement, to the fact that I am going to release a brand new mentoring program. It's going to be a course, which is an online course that you will be able to do at your own pace for registered nurses wanting to become cosmetic injectors and start their own businesses, or people who are already cosmetic injectors that want to start their own business as well.
Awesome.
So that will have full like video, audio, downloadable programs, pretty much everything that I've kind of put together in my current mentoring, but being able to share that a lot more widely and a lot more information in it as well.
Great. And I think as well, like in terms of finding the right course, it can be really overwhelming.
Yeah, there's a lot out there.
Like a one-stop shop.
Yeah.
Great.
Thanks.
You're welcome. This one's really funny. Why isn't there a Medicare rebate for anti-wrinkle?
So many
That's
people
so
ask
good.
this. Do you know back in the day, like when it first came out, there actually was.
So rude that there's not
I know
anymore.
that there's not. But look, because it is a voluntary treatment,
Yeah.
there unfortunately isn't, and I don't see there being a rebate in the foreseeable future.
Yes.
But interestingly, if you do say get like really severe migraines, you can actually go and see a neurologist where they can actually put the anti-wrinkle like right through your scalp. Some people are having their traps and things, and not all the time, but sometimes there may be a little bit of a rebate on that because there is like a medical reason to have that treatment.
Yeah.
But yeah, not something I don't think we'll ever
Not
ever
happening.
see.
Oh, that would be good if there was though.
It would.
Can people be allergic to dermal filler?
Yes, you can.
You definitely can.
So mainly, so dermal filler, as we've discussed, is a hyaluronic acid product. So hyaluronic acid is naturally found in our bodies. So it's very rare for people to react to the hyaluronic acid. If they were to have an allergic reaction, it could potentially be to the additional ingredient in there, which is lidocaine, which is a local anesthetic. So that's why when we are consenting people for treatments, we always ask, do you have any allergies? Full stop. And then I follow with, do you have any allergies to local anesthetic?
Yes.
Have you ever had any issues with local anesthetic? A lot of the time people have already had fillers before, so we know the answer is no. But if anyone was to say, yes, I have an allergy to lidocaine, local anesthetic, we obviously wouldn't be doing filler. Then the second thing to talk about with allergies is the dissolving agent, the hyaluronidase or Hyalase, has the potential to react for some people in a similar way to a bee or a wasp sting. And so the other question we need to ask before we're doing dermal filler is, do you have an anaphylaxis to bee or wasp stings? And if the answer is yes, and in particular if they say carry an EpiPen for it, then we would flat out not be doing filler at all, because yes, we could do the filler and they'd probably be fine. But if we have to dissolve that filler, if we give them a vascular occlusion, or they had any complications, like we talked about infections and lumps and bumps, and we had to dissolve that, and then we're going, okay, we've got to dissolve this, but you're going to have an anaphylactic reaction.
Yeah.
So yes, we also carry adrenaline in the clinic if we needed to use it, but we don't want to put people at an increased risk of those things. So if anyone's answering yes to any of those questions, we just don't treat them with filler, and we just use something else. They'll probably be really upset, but I would rather that than have anyone have an anaphylaxis in the clinic.
Yes.
We don't want to cause any extra harm to any of
We
our
don't.
patients.
No, we don't. We don't want to be calling in Ambo.
Let's not. that would not be very good for our reputation, would it? Ambulance call to a eastern suburbs cosmetic clinic. No.
Yeah.
Let's not.
And it's a very busy street out there
I know.
as well.
Can you imagine an ambulance pulling up at the front? No. Not a good look.
No thanks. Okay, guys. Last question. Woohoo. If I get a droopy brow from will it be permanent?
So we'll talk about why that is beeped in a minute. But no, it will not be permanent. So your worst case scenario with anti-wrinkle injections, and I'll explain why I say that instead of in a minute. Worst case scenario is a droopy brow or a brow or an eyelid ptosis. Now, some patients will come back and they'll go, oh, I've got droopy brows, and then maybe just got like a heavy feeling. Now, if you get a brow or an eyelid ptosis, you will know about it because you will literally not be able to open your eye because your actual eyelid muscle will be paralyzed essentially and like drooping. And there was this really interesting case a couple of years ago. It happened to a female who was overseas, and she documented the whole thing on her Instagram. And it was really eye-opening for a lot of people that can happen. Now, it is absolute worst case scenario. It's like a less than 1% chance. So it comes down to us obviously injecting a correct dose and the correct placement and not overdoing your treatment and not going into areas that are not safe to treat with the product. But also it is so important that you follow that post-care. So like we were talking about before, main thing is that no lying flat for 4 hours. Not having, not exercising, not having facials, massages, anything that could potentially move your product around, and that product could then enter a muscle where we didn't inject it and then cause a potential, and we're talking like a full like brow or lid, like not able to open your eye. Now, it is not permanent, it's temporary, it wears off. It would just be super frustrating because for some people, most people the product lasts around like 3 to 4 months. Some people it can last more like 5 to 6 months depending on their metabolism. So you could be stuck like that for quite some time. So again, it's really important that you do take those risks and the post-care really seriously. It's not something that we're seeing regularly. It is very rare, thank goodness. And I haven't had any patients with a full brow or lid ptosis. Touch. Is there any wood around me? Touch wood. Heaviness, yes, but often it's just that kind of like that feeling, and we either need to let it ease or just like back off your dose a little bit. So extremely rare for that to happen. It is temporary. It wears off. And there are, I was talking about that person who shared it online. There are some eye drops and things that you can get to help kind of like stimulate the muscles around the eye, and that did kind of alleviate that for her a little bit.
Yeah.
But hers did last a good, sort of 12 weeks or so. I want to explain why we had the beeps. So you might think we're swearing. Well, the TGA would think we're swearing. So the TGA is the Therapeutic Goods Administration in Australia. So they regulate medications and everyone calls it, but that is actually the brand name of the medication. So on social media, online, everywhere, as injectors and cosmetic clinics, legally we're not able to say those brand names because that's considered, advertising and persuading and things like that. And a lot of people, they'll just call it, but they don't realize that there's actually 4 different brand names for that medication, which is botulinum toxin type A, which is the muscle relaxant. And so that's why you'll hear us, on social media or writing and things like that, we'll refer to it as anti-wrinkle injections. Yes. And the same thing goes for dermal fillers. And everyone sort of knows it as a dermal filler. Like no one comes in saying, and says like the brand name of it. Everyone just says filler. But actually there are many different brands of dermal filler in Australia as well.
Yes.
So that's why we're never talking about those brands online. They were some really good questions. I really enjoyed answering those. So thank you to those of you who submitted those on Instagram. I'll probably do that quite regularly before episodes just to get a bit more of like viewer input, I guess.
Yeah.
And thank you so much for tuning in to our first video podcast episode, and thank you so much for jumping in for
Thanks
the first
for having
one.
me.
So good to have you.
I feel honoured to be the first guest.
You had to be the first, of course. My new cosmetic injector. So where can you find us? So for these episodes on YouTube, podcasts, Spotify and Apple. And if you want to check us out on social media, we have 2 Instagrams. My one, which is the Fit Injector, and for the clinic, which is the Fit Injector Clinic. And our brand new clinic is located in Bondi Junction on Oxford Street.
You can't miss us. Felicity's face is on the front of the shop. So
when people say, I can't find you. It's like, really? Like a giant version of my face. Scares me the most. Thank you so much.
Thanks.